Welcome, everyone. In this presentation, we will explore environmental EEG artifacts, patterns that appear on the EEG but are not generated by the brain. These artifacts are often produced by electrical or mechanical devices around the patient during recording. Recognizing them is essential because a device-related pattern can sometimes look alarming, and if it is mistaken for seizure activity or an epileptiform abnormality, it may lead to unnecessary concern, misleading reports, or inappropriate treatment. Our focus will be practical: how to recognize common device-related artifacts, compare them with true cerebral patterns, and document them clearly. Next slide, please. Environmental EEG artifacts are non-cerebral signals created by the recording environment. They may arise from electrical fields surrounding the patient or from mechanical effects on the patient, electrodes, leads, or bed. A very important principle is that highly unusual waveforms should immediately raise suspicion for artifact. In EEG interpretation, it is safer to pause and ask, could this be coming from the environment, before labeling the pattern as abnormal brain activity. This careful approach reduces diagnostic error and helps protect patients from unnecessary escalation. Next slide, please. There are four major categories of environmental artifacts to keep in mind. The first is ambient 50 or 60 Hz electrical noise, usually related to the electrical power supply. The second is artifact from electrical devices or motors, which can create sharp, high-frequency bursts. The third is mechanical device artifact, often caused by ventilators, pumps, vibrating beds, or air mattresses. The fourth is intravenous drip artifact, which can produce spike-like transients synchronized with falling drops. Across all categories, the recognition strategy is the same. Look at the waveform, timing, distribution, and an environmental correlation. Next slide, please. Ambient electrical noise is one of the most common environmental artifacts encountered during EEG recording. It usually appears as monomorphic high-frequency activity. Depending on the setting, it may be seen at 60 Hz, especially in North America, or 50 Hz in many other parts of the world. It may involve many channels, or it may be more prominent in selected channels when electrode impedances are poorly matched. When we see continuous high-frequency activity, especially in regions where muscle artifact is unlikely, we should inspect the electrodes, cables, and nearby electrical sources before concluding that the activity is cerebral. Next slide, please. Electrical device or motor artifact can be especially misleading because it may resemble spikes, polyspikes, or muscle potentials. At first glance, the sharp bursts may look epileptiform. However, the key clue is often the fixed recurrence pattern. A device or pump may cycle at regular intervals, producing repeated waveforms that are nearly identical from one occurrence to the next. If the same pattern is also visible in the ECG channel or other non-cerebral channels, that strongly supports an artifact source. A useful question is, what device near the patient is cycling at the same interval? Next slide, please. Mechanical device artifact is usually caused by movement transmitted to the patient, bed, electrodes, or leads. Ventilators, circulatory pumps, vibrating beds, and air mattresses are common sources. Compared with electrical motor artifact, mechanical artifact often contains slower components and may appear as rhythmic waves or mixed frequency complexes. The pattern may resemble electrode movement or other physiological artifacts, but its fixed repetition interval often gives it away. If the artifact coincides with ventilator breaths, pump cycles, or bed vibration, the environmental source becomes much more likely. Next slide, please. Intravenous drip artifact is a classic example of why direct observation during EEG recording matters. Falling droplets in an infusion line can create a moving electrical field, producing low-amplitude spike-like triphasic or polyphasic transients. These may become especially noticeable when the background EEG is low in amplitude. The essential clue is timing. If the transient occurs regularly with falling drip drops, it should not be overcalled as epileptiform activity. The technologist should check the infusion line and annotate the temporal association clearly in the EEG record. Next slide, please. Environmental artifacts can sometimes resemble seizures or periodic epileptiform discharges, especially when they are rhythmic, sharp, or repetitive. The distinguishing features are fixed duration, identical repetition, preserved waveform, and unusual distribution. True seizures usually show biological evolution in frequency, morphology, field, or clinical context. Device artifacts, by contrast, often repeat too regularly and too identically. They may also involve non-adjacent electrodes or show a distribution that does not fit a plausible cerebral field. When a pattern is too regular, too identical, or too device-linked, artifacts should remain the leading explanation until proven otherwise. Next slide, please. A practical workflow helps avoid misinterpretation. First, notice the unusual waveform and pause before labeling it abnormal. Second, search the environment for pumps, ventilators, power cords, bed motion, monitors, and infusion lines. Third, when it is safe and clinically appropriate, test the suspected source by observing, adjusting, or correlating the device activity with the EEG pattern. Fourth, check the channels carefully for ECG involvement, non-contiguous electrode distribution, or impedance-related localization. Finally, annotate the recording. Good documentation allows the interpreting physician to understand what was happening at the bedside. Next slide, please. This pattern board brings the comparison together. Ambient line noise is typically monomorphic and high frequency. Motor artifact often produces sharp, repeated bursts that may initially appear epileptiform. Mechanical artifact frequently creates rhythmic, slow, or mixed frequency waves that repeat at fixed intervals. Intravenous drip artifact produces small spike-like transients that recur with falling drops. In each example, the most important question is not simply, what does the shape look like? The better question is, does the timing, distribution, and recurrence fit the brain, or does it fit a device in the environment? Next slide, please. In this example, the pattern shows very high-frequency artifact that obscures the EEG background in several channels. A key feature is that the artifact does not form a normal contiguous cerebral field. Instead, it appears in a way that is more consistent with local electrode impedance issues and environmental electrical interference. This is an important teaching example because continuous high-frequency activity can be mistaken for other sources of fast activity. But its distribution and persistence should direct attention toward ambient electrical artifact. Next slide, please. Here, the EEG shows very high-frequency bursts with a fixed waveform and repetition pattern. These features suggest an environmental device rather than cerebral activity. The presence of the artifact in the ECG channel further supports a non-cerebral source. This type of pattern is important because it can look sharp and potentially epileptiform, but the repeated identical morphology and timing point toward an electrical motor such as a pump. The clinical lesson is to correlate the EEG pattern with equipment operating near the patient. Next slide, please. This example demonstrates vibration artifact. The waves are short in duration, often triangular in shape, and recur in runs with a fixed interval between them. Some waves appear more complex because faster frequencies are superimposed on the slower waveform. In a clinical setting, this kind of artifact may be produced by an air mattress or another source of rhythmic vibration. The fixed interval is the key clue. When the timing is mechanical and repetitive, the environment should be investigated before considering a cerebral explanation. Next slide, please. This example shows a contoured bilateral frontal repetition at a fixed interval. The source is a circulatory pump, and pulse artifact is also visible in multiple channels. At first glance, the sharp contours may draw attention, but the regularity in relationship to a mechanical device are the important interpretive clues. This reinforces a central principle. Artifact recognition depends not only on waveform shape, but also on timing, distribution, and knowledge of the patient's surrounding equipment. Next slide, please. The take-home message is simple. Think device, think pattern. Environmental artifacts are common during EEG recording, and many are recognizable because they are fixed, stereotyped, and temporally linked to equipment, movement, or infusions. The safest approach is to inspect the recording environment, correlate the waveform with possible device activity, and document the observation. Careful recognition protects the patient from false positive interpretation and strengthens the quality of the EEG report. Next slide, please. Thank you for watching. The main point to remember is that not every sharp, rhythmic, or unusual EEG pattern is cerebral. When a waveform is unusually regular, repeatedly identical, or linked to the recording environment, artifacts should be strongly considered. Careful observation, bedside correlation, and clear annotation are essential parts of high quality EEG interpretation. This was a presentation from Professor Mohammadi's Educational Archives.